So in this video, we're going to talk about thoracic spine mobilization in prone. So in prone, I mobilize this the same way that I mobilize T1, 2, and T3 through the arm, okay? So I'm going to just come down just the border of the spine and just feel what's not moving well. And I'll just do a left to right kind of rotational spring test. So I just use my thumbs and just kind of feel what segment am I interested in. So that's pretty stiff right there, but I'll just keep working down and see what are my areas of interest. And really right here is the stiffest spot for me, okay? And then if I want to see, is it pure rotation versus is it a superior emphasis with rotation versus a inferior emphasis, and it's more of an inferior emphasis. So straight rotation, inferior are the two most restricted here. All right, and I should say this too, when we do this, our intention is a functional intention of kind of a three-dimensional motion. So I'm not just getting right on the spinous process and doing a pure PA. I could do that. I may find the same thing, but specifically with this mobilization in prone, I am more interested in, for this specific one, would be more of like an extension quadrant motion of extension, side bend left, left rotation. Whereas if it was more of a superior restriction, right? Then now I'm actually moving into the into more of a flexion quadrant on the right side. Okay, so it's just a kind of a depends on the direction of your force is the intention of the functionality that you're trying to do. So again, if it's closing, right, it's more of this motion, right? If it's more of an inferior hard infill, it's this motion. And if it's more of a superior hard infill, it's more of this motion, all right? That's kind of how I'm thinking about it, at least. All right, now bring your, actually let's go through this. So if it were a superior direction, my mobilization would be hand on the sacrum, or the back of the hand on the sacrum, and then I would be localizing because the scapula would be moving things up and across, right? And that would help with that quadrant, all right? If it was just purely rotation, I'd bring the hand right beside the shoulder, and then I would just bring the elbow up towards neutral, and then that helps provide a little pure rotational motion, okay? Now, what I'm most interested in with Kelsey right now is more in this direction. So you can imagine with the angle of this humerus, if I bring her arm up and the scapula glides down and back, now we're actually going into the direction that it's most restricted, okay? So in order to do this, I'm going to find that tightness or that thoracic spinous process that doesn't want to move. I'm going to block it in that direction. I could use my thumb. I could use kind of like a key grip here, right? I could use my fingers, but I don't love that in this position. So I'm using more of a key grip with my thumb. I bring her arm up until it engages that infill, and now I have her, don't let me lift you up there, Kelsey, any higher, keep it there. And then that engages right into my thumb. So it gives me that infill that I want, and let it go, okay? And you do that several times and hold there until it either felt like, hey, that feels pretty good, or it's not improving anymore, okay? And then we can re-educate that there, so hold that up, keep that elbow high, good, really kind of keep that spine right there. So I'm going to the other side of that spinous process. Don't let me pull it down, keep it up, hold it there, hold it there. And she actually has decent stability there, so I could add a little bit more resistance. I'm tractioning through my left hand to really try to radiate into those lower traps there. Hold that there and relax. And she's shaking. But essentially, if we got a good, strong contraction, then we can go into a little combination of isotonics just to try and help claim some of that range that we got in the thoracic spine. Okay, so this is working on functionally working on thoracic spine in prone with localization through the arm.